Again, I think this is a very important slide. What we should do is there are very few ways to prevent breast cancer. Now, there are modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are by living healthy, eating healthy, getting your exercises, eating the right kind of food, avoid red meat, eat your colored fruits and vegetables like your beetroots and your papaya and carrot. And because they have a lot of antioxidants in them, they're known to prevent cancer. That is the general rule for any kind of cancer. And if you're able to eat well, if you're able to get your half an hour of exercise every day, you've actually kind of started your battle against any kind of cancer. I'm not just talking about breast cancer. Other than that, what we should do? So there are very few ways to prevent breast cancer. What we want women to do is to come early to us, because we can actually cure her and give her a very normal life. We should start checking ourselves after the age of around 25 to 30. When I say check ourselves, I mean self-breast examination. We should do our self-breast examination between day 5 and day 10 of our periods. If our period starts today, according to everybody across the world, today is the first day of my cycle. So between day 5 and day 10 is when we have to check our breast. If there is a painless lump in the breast, and between this period and the next cycle, if the lump has significantly become bigger in size, you have to go see a doctor. Maybe your GP, maybe an oncologist, maybe a gynecologist, because gynecologists are not really trained for breast cancer in India. But yes, if you have a painless lump that is increasing between this period to the next, you have to see your doctor. The other way to do it for postmenopausal women or women who've had their hysterectomies is to check yourself once a month. You pick a day, the first day of the month or the first Sunday of the month, check yourself. Self-breast examination, according to me, is the most important thing for self-care for breast cancer. The other thing that we add is a yearly screening, or mammogram or ultrasound, or a sonomammogram is what most women call it. WHO has cut it off at 40. WHO says after 40, every woman has to have a mammogram. Less than 40, every woman has to have an ultrasound. But actually in practice, what we tell patients is that till menopause, you get your ultrasound breast done. After menopause is when you have to get your mammograms done. If you get a mammogram at the age of 36 or 40, when you're having your periods, the mammogram simply will not be able to read anything, because the kind of breast tissue that is there is different. So mammograms always have to be done after menopause. And if you have had a mammogram, and obviously you know how painful it is, you're not ready to get a mammogram done, ultrasound can be done even in postmenopausal women to pick things up. Now, if these mammograms are normal, then the mammograms are spaced around 12 months apart for your health check. So 12 months is a very long interval, which is why the self-examination comes into play here, which can be done every month.
Subscribe now and press the bell icon. Never miss an update.